Every patient has COVID now.
To make room for the steady stream of COVID-19 patients, more than a dozen hospitals across the GTA are now clearing out their pediatric wards. That means children and teenagers will now be treated at Sick Kids Hospital, which has also just opened a COVID wing for adults. I'm told almost all of those 8 ICU beds are already occupied.
It's not looking good right now. We're at 600 beds now. When we hit 900 beds in Ontario, that's when the system will fall apart, basically. That's the limit. And the way things are going, we're adding 60 to 70 a day. We're going to hit that very soon, like maybe in a week or two.
Just 2 weeks ago, the Premier announced that this would be the day salons and barbershops in the gray zone would finally be allowed to reopen. Instead, surgeons are calling their patients to tell them their operations are no longer happening.
Someone who's had, knee pain or hip pain for a year was waiting all year for that operating time, and that's gone. Someone who needs a surgery to find out what kind of cancer they have, that's been pushed off as well.
Is this a full-blown healthcare crisis?
Oh, absolutely. What else would you call it?
The president of the Ontario Hospitals Association tells me every staff member and resource are going into treating COVID patients. There's little room for anything else, and the virus is showing no signs of slowing.
This pandemic has got Ontario under siege. The virus is trying to bring Ontario's hospitals to their knees, but the hospitals are fighting with everything they have to make sure that doesn't happen.
Over 3.2 million.
Today in the legislature, Ontario's health minister said delaying surgeries, redeploying staff and doing transfers will help build the capacity needed.
We will be able to create between 700 and 1,000 beds to make sure that we can deal with the incoming influx of patients. In fact, by the end of this week, we anticipate having created 350 net new spots. So we are dealing with it.
Is that enough to make sure everyone who needs a bed gets a bed?
Well, I don't know. What I think the minister is really saying, though, is that the system is redeploying to do everything it can to anticipate and meet the needs of a huge wave of COVID-19 patients.
I think everyone can do something as well. Don't go indoors. This thing is really contagious now, especially these variants. It is everywhere in the GTA.
Shauna Hunt, City News.